Preliminary Care Coordination Plan for Mental Health. Background. A preliminary care coordination plan integrates many healthcare tactics to guarantee that a patient obtains the highest caliber of treatment. Providing a coordinating structure that gives patients and their families control over the process is essential for the most outstanding results. Creating a comprehensive care plan addressing patients' significant issues is vital in healthcare. The strategy helps resolve the problems and difficulties that patients and their families encounter. Nurses must recognize patients' needs at the proper time to direct effective, appropriate, and safe care delivery and prevent future harm to patients' well-being. Care coordination tasks include determining patient requirements, setting objectives, locating community resources to solve the health issue, and assisting with care transfer. Healthcare problem. A sizable percentage of people worldwide have mental health problems. This health issue affects people regardless of political beliefs, racial heritage, social status, or gender. A mental health issue affects one's sense of self, changes social interactions, and heightens uncertainty. The goals, community resources, multidisciplinary cooperation, and core skills necessary to accomplish the intended patient and organizational outcome will all be emphasized in this coordination plan. It is the responsibility of the care coordinator to comprehend the numerous parts of mental health, the signs and symptoms, and the steps to be taken to enhance continuum care. Several classifications for the degree of mental disease must be determined. The most effective strategies for managing mental health problems involve symptom-relieving psychological, physical, and cognitive therapies. The development of a health intervention plan must include the patient and their family if patient outcomes are to be improved. Moreover, individuals should engage in self-care activities, including avoiding conditions like drug misuse that might lead to mental health issues and attending classes on handling such matters. A preliminary care plan that puts the patient first enhances their condition and incorporates their fundamental values and beliefs to treat their mental health issue. Healthcare providers should employ patient-centered strategies, encouraging positive thinking, high self-esteem, and rights knowledge. In providing mental health treatment, multidisciplinary, interprofessional teams must be integrated. When interprofessional interactions are built on patient-centered paradigms, patient outcomes are of more excellent quality. In addition, this approach improves patient status and satisfaction while decreasing the incidence of hospitalization, clinical errors, and suicide. To overcome barriers, including time restrictions, power imbalances, medical supremacy, a lack of resources, and communication issues, the collaboration of mental health care teams needs supportive frameworks, hard effort, and patience. Multidisciplinary cooperation is an approach for increasing team flexibility and recognizing how people's perspectives of their jobs are impacted by their environment. Depending on an individual's beliefs and religious teachings, attitudes or cultural perspectives on mental health issues vary. The preparedness and willingness of patients to seek medical care may be negatively impacted by these beliefs, which might lead to stigma. Effective healthcare strategies must be established, which requires understanding societal and personal perspectives on mental illness. Cultural variety affects how people throughout the world see mental health, how they seek out medical care, and how they view mental health professionals and systems. Low self-esteem, childhood psychological trauma, early parent loss, and neglect are psychological risk factors that might result in mental health issues. Goals established to deal with the problem. Mental health issues need specialized therapies and methods to improve patients' well-being. One strategy is ensuring the patient gets access to the knowledge, setting, and tools needed to address their problems. Patients ought to have access to mental health self-assessment instruments such as health questionnaires, the Generalized Anxiety Disorder Scale, the Insomnia Severity Index, and a tool for calculating the degree of substance abuse. The patient's health will significantly improve due to using a patient-centered paradigm. The preliminary plan will address risk factors and allow patients to understand the caregiving models that will improve their condition by including family members and community stakeholders. The patient's family is the primary participant in the coordination team. The strategy aims to identify the risk factors in the community, at home, and at work. Those with ongoing issues require active care coordination, such as engagement and outreach, which supports them while switching healthcare providers. Community resources. Mental health clinics and community health centers provide counseling, therapy, medication management, and other treatments to meet patients' requirements. Individuals with mental health disorders frequently get thorough care from mental health specialists in these institutions. Moreover, support groups offer people a secure setting to interact with others facing comparable difficulties, share their experiences, and learn coping mechanisms. Peer support groups allow people to get help from those with first-hand knowledge of mental health issues, which can be a beneficial resource for many. Nonprofit groups and community-based projects may also provide educational opportunities and outreach programs that can assist people in becoming more aware of mental health issues and connecting with the needed services. Conclusion. In conclusion, a preliminary care coordination plan ensures patients receive the best quality care. It requires a coordinating structure that puts the patient and their family at the center of the process. Mental health issues affect people from all walks of life and require patient-centered strategies, multidisciplinary cooperation, and community resources. Healthcare professionals must create appropriate therapies and approaches, identify risk factors that affect the patient's mental health, and consider the various cultural and individual viewpoints on mental health concerns. Accessing community resources, such as nonprofit organizations, community support groups, and educational opportunities, is essential to establish an effective and safe care continuum. By focusing on the patient's distinct requirements and enhancing multidisciplinary collaboration, healthcare providers can improve patient outcomes and overall satisfaction, reduce clinical errors, and increase treatment compliance.